my name's Debbie, and I have lung cancer. I found out in 2015 I had a cold or a cough that wouldn't go away, and so I went to a ready-med. I call it a doc in the box, and they told me I had pneumonia, but they wanted me to follow up with my primary, and so I did. And as soon as she looked at the x-ray, she was like, oh, this is not good. And set me up with another doctor out near Lakeview. And we started, finding out what was going on, did the biopsies, and determined that I had lung cancer. I was with the other doctor for the first cycle, which is about a month. And it wasn't a good fit. And I had a friend tell me that I needed to check out Dr. Saux. He treated my cancer aggressively. I did 6 months of chemo, which is like 20 chemo treatments. It was always, okay, this is what we're doing now. We're going to see where you're at. We're going to continue on. He helped me maintain a positive attitude. I've been on it ever since. My tumors from the chemo reduced by like 80% in size, and since I've been on Devo, they've actually reduced some more, and they're not as active. Not just his ability as a doctor, as a physician and an oncologist, but that positive attitude. It makes a difference. He manages all the aspects of the treatments, from just giving you treatment to like kill the cancer cells, down to managing the side effects of those medications. If you're nauseated, you make sure you get the right medication so you're not sick all the time, so that you can eat from the top to the bottom. They're a great group of people. It's like family, and they treat you like family. Me personally, as much as I don't want to have to recommend somebody, when I do find out that somebody has a cancer diagnosis or they think they may have cancer, I do recommend Dr. Saux. And if they can't get in with him, I recommend Dr. Carrender. I have some friends that are Dr. Carrenders as well. And so, I just think that they're a really great group of doctors, nurses, NPs. I mean, Dr. Saux has got two of the best PAs ever, Kelly and Sydney. And it's like going to visit family when you go in there. Like, hey, how you doing? And, so it's not so depressing. The other doctor I went to, it was very clinical and very sterile. And there's a time and a place for that. But for the most part, especially like somebody in my position, I go every other week, and I've been doing that for 5 years. So every other week I see those people a lot. I see them an awful lot. And so for it to be comfortable like that, it's great. When I walk in, because I've been there so much, hey, Miss Debbie, how you doing today? They all know all their patients. But I also know from watching Dr. Saux with other patients that he cares about all of his patients, not just the ones he clicked with. I've seen him with people that they're like, I don't know, he's kind of different, but he's a really good doctor. So, he's a little different. He likes dressing up, and that's kind of fun too. Because you never know what you're going to get when you go in. You could get a tutu or a kilt or whatever. So, I can't say enough good things about them. I really can't.